are TKIs. These are oral pills that work extremely well in people that have an EGFR mutation. But unfortunately, they don't cure patients. So they respond to the treatment, their cancer gets smaller, they feel better, and that lasts on average just under a year, although there are certainly responses the last 3 months and there are responses the last 10 years. But half of the time, when the patients get resistant, the cancer gets a mutation in the same gene, but the new mutation prevents the drug from binding to the receptor. And that resistance mutation in almost all that half is something called T790M. And then 2 companies have made drugs that are being tested that are specific for this T790M. The general thing has been to biopsy the tumor at the time of recurrence to see if T790M exists in the tumor. And that requires an extra biopsy. If the cancer's in the middle of the lung, that may be complicated to get the biopsy, and sometimes you do the biopsy and there's not enough tissue. So cancer cells often circulate in the blood, and oftentimes cancer cells secrete their proteins and their DNA into the blood. And people have shown that most of the people who have a T790M not only will secrete DNA with that mutation into the blood, but oftentimes they'll secrete that into the blood before the tumor enlarges enough that you're going to biopsy it. So you can predict ahead of time that the patient's going to progress with T790M. Analyzing the blood is a lot easier than analyzing a biopsy. So that would be an advance in 2 ways. One is you wouldn't have to biopsy the tumor, you could biopsy the blood. It's not obvious, but it's possible that finding the recurrence sooner could help the patient by giving them an agent that would delay the time to recurrence.